Many, if not all of us, are familiar with Tylenol, the headache and pain reliever introduced way back in the 1950s. The first case of autism, however, was diagnosed in 1911. That, according to President of the Bahamas Pharmaceutical Association, who tonight points to flawed studies that he says pokes holes into a recent correlation between the two. Cleopatra Murphy has the details.
Causation and correlation are two different things.
President of the Bahamas Pharmaceutical Association, Dr. Marvin Smith, is dismissing the Trump administration's suggestion of a link between the use of Tylenol or acetaminophen and autism, insisting officials still don't know what causes autism. He takes issue with the study used to support the position.
That study came off of another study that was done with about 150 kids, a small study. But what they realized was that if you use Tylenol for more than four consecutive weeks, they thought that that would be a risk factor. Well, here's the thing. Tylenol is not made to be used for 4 consecutive weeks.
Dr. Smith believes there needs to be more studies tracking pregnant women prior to giving birth, adamant that Tylenol is safe based on years of studies. He urges expectant mothers to speak with their doctor before ditching Tylenol, the only drug deemed safe for pregnant women combating pain or fighting fevers.
In pregnancy, treating fever is critical. All right, you do not want to be a febrile, that's what we call a febrile pregnant patient. All right, that directly impacts the fetus within the womb. So you want to make sure that you anytime you get a fever, yes, you want to treat that. That's not something you want to carry on for a couple of days.
Medical experts predict untreated fevers could lead to miscarriages, birth defects, and high blood pressure. Gowan Bowe, the parent of an autistic child, also finds the Trump administration's assessment troubling.
It's very disingenuous and very dangerous to sort of suggest that, there is what I'm going to call such a direct and strong correlation with what has up to this point in time been a very harmless sort of over-the-counter medication used for pain relief, etc.
Bowe says medical professionals globally have largely dismissed the claims, while for the FDA's part, it says while studies have hinted at an association, a causal relationship has not been established. The Public Hospitals Authority confirming they have not received any recalls or official directives from manufacturers or vendors regarding Tylenol, despite remarks made this week by the U.S. President. For the Bahamas Tonight, I'm Cleopatra Murphy.